Hello, this is Dr. John Staley, President of your Home Team Care. I hope you're having a good day. I want to talk a little bit about vision and cataract awareness. Obviously, as we age and things change, our vision many times changes. And we've all heard of elders and people getting older that wind up having visual changes, and such as short-sightedness and far-sightedness, and needing glasses, for example, these to read things up close. So that's pretty normal. And of course, what we have to do is have normal eye exams. And I've found it very helpful a lot of times, because I had an acute onset of nearsightedness when I was in my 15 and 16, and suddenly couldn't see the jerseys of other teams on the other opponent playing quarterback. That's not a good thing to do. So you start throwing the ball to other players instead of your own team. Secondly, regarding this same kind of change you may observe occurs as we get older. So what are the signs and symptoms of cataracts, and how do we know about it? Well, the first thing I like to do is always look at an eye chart, cover one eye up to see if I can still see 20/20. And if you were doing that and you say to yourself, well, wait a minute, when I cover one eye up, I can't see the eye chart. Well, first of all, you need to get to see an ophthalmologist or an optometrist. Those are the physicians and folks that assess our eyes. So just regular checks to see how you're seeing. I wear a contact in my left eye, and so in my right eye, I can see 20/15. In my left eye, I'm best at 20/25, which has been amazing, because I have had a cataract in my left eye, and they said, well, we can't believe you're still seeing 20/25. So visual eye checks regularly are an important facet. What are some of the signs and symptoms of maybe something more severe? Well, first of all, if people start having cataracts and other eye real challenges, you start seeing what's called floaters. So, for example, you'll be having a visual effect to look at a ball game, a TV, and all of a sudden you'll see a floater up here, and you look, well, there's nothing up there. Or it may be a little white spots that run right across your eyes. And these are abnormal happenings that are happening to your retina, so to speak. And it does require you to go get an assessment from an ophthalmologist. It's interesting, they do all sorts of tests to show the visual field effect, how your eyesight's seeing, and it's really interesting. So once again, if you got a cataract, it doesn't mean you're not going to be having visual deficits totally, but you need to assess when there's that deficit to a point that may require surgery. And you also need to know that there are certain times you should be driving after dark, for example, if your vision changes then. So we hope you're going to have a great day, and my message to you is make sure you have eye checks regularly. You can help yourself by looking at eye charts and assessing your own vision. Thank you.